Hypoparathyroidism. The parathyroid glands are located behind the thyroid gland in the neck. The biggest job of the parathyroid gland is to help regulate calcium levels in the body. Calcium is very important for bone health, muscle regulation, nerve regulation, and blood clotting. Another thing I want you to remember is calcium has an inverse relationship with phosphorus. So whenever calcium is high, phosphorus is low. In hypoparathyroidism, there is hypo, decreased secretion of the parathyroid hormone, which then leads to low calcium levels and high phosphorus levels. Let's talk about the causes. A parathyroidectomy, where the parathyroidectomy is removed. A thyroidectomy, where the thyroidectomy is removed. A radical neck surgery, because we know that the parathyroid is located in the neck. The signs and symptoms of hypoparathyroidism. Since calcium helps to regulate nerve function, one of the symptoms you may see is called paresthesia, which is pretty much your patient may complain of numbness and tingling in their fingers, around their mouth. Calcium also helps with muscle function, so when there's low calcium, you may see muscle cramps and muscle spasms. And when the muscle spasms are severe, we refer to them as tetany. Severe tetany can lead to bronchospasms, which can affect the patient's breathing. It can lead to laryngeal spasms, which can affect swallowing, so you may see some dysphagia. And it can also cause spasm in the heart, cardiac spasms, which can lead to dysrhythmias. Tetany can also cause seizures to occur. Now, there are two signs of hypocalcemia. For the 𝐬𝐨𝐫𝐞 sign, the medical provider taps on the side of the cheek, and this causes muscle spasming and twitching around the mouth, cheek, and throat. Also, the 𝐼𝐸 sign, which happens when the medical provider applies a blood pressure cuff on the upper arm and inflates it about 20 mm above the systolic blood pressure, and this causes carpal pedal spasms, which is contraction of the muscles in the hand and the wrist. What is your job as the nurse? Since you know that hypoparathyroidism can cause cardiac dysrhythmias, you want to monitor the EKG. You know there's a lot of muscle spasming going on, so monitor the patient's neuromuscular status. We know the calcium is low, so we're going to provide the patient with a high calcium diet. And since there's an inverse relationship with the phosphorus, we're going to provide the patient with a low phosphorus diet. Low calcium levels we talked about can also cause seizures, so make sure you have your patients on a seizure precaution. You may expect to give medications like IV calcium gluconate or oral calcium salts aimed at increasing calcium levels. Share this with somebody who might need it. Bye-bye.